name is John Doe. I'm going to be your nurse today. The doctor ordered a urinary catheter to be inserted just to help with that urinary incontinence that you've been having. Before we get started, can you state your name and date of birth? Okay? Alright, awesome. Now we're going to check your wristband, scan it just to make sure it's consistent with the order. Okay, everything looks like it's going good. Okay, so before we insert the catheter, I'm going to perform peritoneal care. So I'd wash my hands and then I'm going to put on gloves. Do you have any questions about the procedure or anything? So you will feel a little bit of discomfort with the catheter going in, but if it causes you too much pain, you can tell me to stop and we'll start over. So don't worry, I'm going to walk you through all the steps. So we're going to raise the bed to waist level. And you are going to be in a position called dorsal recumbent, which is basically you're laying down with your knees propped up. Okay, so I'm going to have to expose you for this procedure. Okay, so for perineal care, we just use a washcloth. Alright, so we're going to clean front to back, the other side, front to back, as well as the middle, front to back. Awesome. Okay, so now we are going to take off our gloves and get ready to insert the catheter. So then I would perform hand hygiene again, and then I'm going to open this over the bed. So the outside of this is not sterile, so I can touch it without sterile gloves. Alright, so for this patient, the legs kind of fall, but in real life we would get someone to help hold their legs up so it doesn't break sterile field. So I am aware that it does break sterile field, that the patient's legs are touching everything. Okay, so I can touch the outside but not the inside. Okay, I'm just going to pop this leg out because it's really annoying me. Alright. Alright, so now we're going to put on our sterile gloves. And I'm not going to turn my back to the patient or anything. So I can touch the outside and the outer corner. Alright, so I pinch the first one, and then cuff the second. Alright, so our sterile gloves are on. Now we're going to press down the inside. Okay, awesome. Okay, so we're going to get all of our supplies set up. It touched the patient's legs again, so that's breaking sterile field. Taking the catheter out. We're just going to use this as trash. Okay. So first we're going to pour our betadine. Oh, okay. Before I get started with betadine or iodine or latex, your order said you don't have any allergies. Is that still correct? Okay, just making sure. Betadine. Now I'm going to connect the sterile water to the port. we connect it at the pink port. Alright, awesome. So we're going to go ahead and clean your meatus and everything around it with betadine. So I'm going to put my non-dominant hand here, so this hand is not sterile anymore. And I'm going to clean front to back around the sterile field. So I just broke sterile field. Front to back around the sterile field. And front to back. Just one time in the middle. Okay, awesome. You're doing so good. Alright, now I'm gonna put lube all in there. We're gonna go ahead and put our sterile sample over here because we don't need it. Okay, so for a female, we're going to lube and then we're gonna insert until we see evidence of urine. Okay, so we see urine, so we're gonna go 2 to 3 inches more. Are you feeling okay? Okay, good. You're doing so good. Okay, so now that the catheter is in, we are going to blow up the balloon, and whenever we blow up the balloon, we're going to hold the catheter between our fingers at the meatus, and we're going to blow it up. And the balloon basically inflates inside to help it stay in. So now we're going to pull back. See, it's nice and steady. So now we are going to keep and twist. All right. You did so good. Are you feeling any pain or discomfort? Good to hear. Okay, so now we're going to attach this to your leg. And we're going to put the urine bag at the base of the bed because we don't want it above you, because then the urine would drain back and that just causes a bunch of issues. Okay, so now we're gonna get this all cleared out of the way. Cover you back up. Alright, so now I can take off my sterile gloves, and now I'm gonna take a sterile specimen. So before I do that, I'm going to wash my hands, put on some more gloves. Okay, before I put on clean gloves, I'm gonna get my supplies out. Okay, so wash my hands again, put gloves on. Okay. Miss John Doe, so the doctor wants me to collect a sterile urine specimen just to run some tests on your urine. So to do this, we're not going to fully expose you. And we are going to clean the blue port as well as clamping it. Also, the clamp broke, so we are just going to pretend like it's clamped. So we would clamp it and then clean it. Okay, so we're going to draw it back, twist, put the sterile specimen in, and then we would send that off to the lab or wherever the doctor wanted it. We're going to make sure to unclamp it because that can cause a lot of problems. So we're going to unclamp it. Everything's good. Okay, so it's going to be the next day. We're going to take out the catheter. So I'm going to wash my hands, put on clean gloves. And then, hello, Miss John Doe. We're going to take out your urinary catheter today. So I'm sure you're really excited about that. So I'm going to have to expose you. To take out the catheter, it can be kind of messy, so we're just going to put a towel right here. So before we take out the catheter, I'm just gonna empty your urine bag, and we are going to unattach it. Okay. Did not mean for that to happen. Okay, so now the balloon is still inflated, so we're just gonna uninflate that balloon so it can ease out. All right, so you're just gonna pull back. Okay, we're gonna make sure to keep pulling back. Okay, so we can dispose of that, and you might feel a little mild discomfort whenever I pull this out. Awesome, you did so good. So we're just gonna wrap all of this up in the towel and dispose of that. Thank you so much for being such a good patient. Before I leave, I'm going to lower the bed to the lowest position and make sure that 3 bed rails are up, and it looks like 1, 2, 3 are up. So let me know if you need me. Try to get some rest. I will be back, and I'm sure to check on you very soon. Bye bye.